Yeah, I just had a question about the fertility. I know there's been some back and forth. In my mind, it's one of those things you never really know because someone can get the vaccination, have fertility issues that they would have had right away, but it's still a question of mine, like, does it increase infertility?
So, yeah, I understand it. I think a lot of people have had that question, and whenever we're talking about anything, medications, knowing long-term effect is always hard. But again, this is
Mm.
why things are, even after they get their FDA approval, are continually watched. But a lot of this stems from a problem that we've seen during the COVID vaccination, is that that information sort of, and for lack of a better way of saying it, misinformation sort of
Mm.
snowballs and moves ahead. Because when we think about it, especially when we think about other vaccines that we've had, the idea of causing infertility in people has never happened. And I think people have extrapolated that. And what is actually scientifically plausible for us nerdy people like me, who are science people who have studied vaccines, it's almost hard for me to even fathom, how did we get from talking about a vaccine that prevents a viral illness like this to talking about it causing infertility. I, as a person who's been studying science for over 20 years and all that, it's hard for me even to make that connection. And we don't have that information. And so a lot of people get caught in the idea, well, we just don't know. But when we look at other examples of vaccine, other things in history over it, this idea is really one of those ones that is hard for us to kind of understand how it even became an issue. But I understand why, when you hear it, it becomes a big concern for parents. But I will say that, again, I have two daughters who have been vaccinated, and if there was any hesitation, and there wasn't, I would understand why that might be part of it. But no, there does not. There's no link between the COVID vaccine and infertility.
And so if I can answer this question, because I want to answer the question as a woman, right? Because I actually had to consider the same question, right? I think it's important, and I'm going to say it here, and I say it all the time, that yes, I might be speaking from, I am speaking from the lens as a pediatrician, as someone who went to medical school and residency. At the same time, I'm a person, right, that also has to consider my health aspects. And I have the same questions that many of you may have. So, as a woman, when we started to, and I'll say here, right, there were questions about infertility. I went straight to medical sources, right? And I started I did my own reading and my own research from, peer-reviewed literature, and saw it was coming out there, and found in the studies that there was not at the time any indication for infertility. I still wanted to weigh those factors, right? Because I'm a woman that's still in my fertile window or childbearing age. If you guys want to guess what my age is, right? But that was important to me, right? Is that I still have the opportunity to have children. And right now, I do not have children. I have my patients, which are great. But, if I want to have the opportunity to have children, is this vaccine going to be something that is going to impact me? And then also, as a Black woman, I also know that I do have higher percentage of infertility, or at least complications with pregnancy when it comes to that regard. So I weighed all of those factors. And then I said to myself, Priscilla, if I get infected with COVID-19 and I die, right? I mean, there goes my infertility. That really is how I played that. And I know that might seem very just like straight and straight to the point, but that was a reality for me. I have three younger sisters between the ages of 25 to 32. I said younger than me. So again, we're getting closer to how old I am. And when they talked to me about it, I gave them the utmost confidence, right? All of them, of course, want to be married and have children. And we had that discussion about, again, like a risk versus a benefit. And to date, we've not had any vaccines that have been demonstrated to cause infertility. And what gave me the greatest reassurance actually is that the American College of Obstetrics and Gynecology, so OBGYN, so we have OBGYNs, right, who they are in the business for fertility. have actually come out and endorsed and approved pregnant women and all women to get the COVID-19 vaccine. So they were able, right, to again review the studies, review the literature, come together as a body and say the COVID-19 vaccine is safe for all women. And they actually are advocating for women who are pregnant and expectant to get the vaccine as well, again, to decrease any complications if they were to get infected from the vaccine. So Kanisha, I understand it's a very important question. And I, as Priscilla Mpasi, not as Dr. Mpasi, had to get my own information and make that decision for me.